Hi, it's Marcus Cheatham. I'm the health officer at the Mid-Michigan District Health Department, serving Clinton, Gratiot, and Montcalm counties in central Michigan, coming to you from the sun porch of my house. It's March 3rd, 2021. This is the first day this year I've been able to work out here. So that's good news. You might hear the sounds of cooking going on in the background. Just don't call me late for supper. I have four things that I want to talk about this afternoon. The first is the Mid-Michigan District Health Department got a lot more vaccine in this week. I want to tell you what we're doing with that. The state just announced new categories of people who are eligible to be vaccinated. I want to share the details of that with you. They also expanded the emergency orders. There's now more things we can do together, indoors and outdoors. What's that? Where to find that information? And then they just dropped the Johnson & Johnson vaccine on us. So I want to talk to you about why that vaccine is a great choice for a whole lot of people. So last week, we were told we were going to start the week, we were going to get 1,700 doses of vaccine. And then at the last minute, they increased it to 4,400 doses. So we started scrambling to get some additional clinics stood up and some doses out to community partners. Then they told us we were getting 1,300 doses of the Johnson & Johnson vaccine. Then yesterday, more doses of Johnson & Johnson and more doses of Moderna. So this is what it's like where we live. Changes from minute to minute. So we're now scrambling to get 6,500 doses out to you. So that's a really great thing. So watch our website. We're going to have more clinics. We're going to put clinics in the community. We're looking at Carson City because everybody in our 3 counties can reach it. We're going to be pushing more doses out to community partners. So please check the pharmacy websites, check the hospital websites. So there's going to be a lot of different places where you can get vaccinated. And if it's confusing, just call 211, 211. Okay, eligibility has been expanded. So I want to share my screen with you to talk about that. As you know, we've been working on the group 1As and 1Bs. 1A is healthcare workers and 1B is people over 65. Last week, it was announced that this Monday, the 1st, eligibility was going to be expanded to people in high-risk agriculture settings. So food processing, the factory floors of places where they work with agricultural products, where people are squeezed in and can't socially distance. So we are starting to reach out to that group. Also mortuary workers. We've had some mortuary workers in already. Then today it was announced that next Monday, the 8th, it would be expanded to include people over age 50 with high-risk medical conditions, and also the caregivers of children with certain risk factors. Remember, you can't vaccinate children. How do you protect them? You vaccinate their families and their caregivers. So what's a high-risk medical condition? For an adult over 50 or for a child, those details are coming, will be posted on our website and will be posted on the Michigan coronavirus webpage. We're going to visit that in just a moment. But I just want to say, like almost all counties in Michigan, we have only vaccinated about half of our population over 65. Look, we've used every single dose we've gotten. We're not slow, we're working fast. We've used every single dose we've gotten, but we still have only done half the people over 65. So we're going to go slow about doing these other groups because these folks over 65 are at risk of dying of this disease. They've been waiting patiently for weeks. We do need to get to them. So please be patient. So new emergency orders. So let's look at that. So this is the michigan.gov/coronavirus webpage. This is where you'll come to find the guidance about exactly what a high-risk medical condition is, or to our webpage, mmdhd.org. But if you want to see about the new epidemic orders, that's right down here. You don't even have to scroll. It's this link right here. And you come to the epidemic order webpage, and it is right at the top. So first thing right here, very exciting to hear that visitation in long-term care facilities has been opened up. For most settings, a test is required. But hey, we've been dying to see our relatives. They've been dying to see us. So we can do that now. Then here's the uh, uh, infographics for the new emergency orders, and they're super easy to read. So I just want to look at the first one on capacity limitations. So here's the new guidance right here. So indoors now up to 50 persons, residential gatherings outdoors up to 50 persons. So that's really nice. And then for non-residential settings, outdoors up to 300. So thinking about things to do in the spring, we can start planning for that. And then on the second page, food service. Okay, restaurants now at 50% of normal capacity right here. So there are a lot of details. I can't possibly go over all the details. So I'm showing you where to find those infographics so you can inform yourself about that. And look, the state told us exactly what they're doing by opening things up. I'm a health officer. I'm not sure I want them to open things up. I'm afraid it's going to start spreading again and killing people. I'm executing the play the coach has called. She said, this is what we're doing. This is what we're doing. They're trying to signal they know people want to have a semi-normal summer, and that if we can keep the cases down, that might happen. They're also saying if the cases go back up, they could go backwards again. So please be safe. Don't spread this virus around. So the last thing to talk about is the Johnson & Johnson vaccine. It's a really great vaccine. Why am I saying that? You probably heard on social media, it's not as good as the Pfizer or the Moderna. Look, nobody knows that. The Johnson & Johnson vaccine was subjected to a harder test. When it was tested, there was more COVID circulating at the time. So all other things being equal, just randomly, you'd expect a few more people in the Johnson & Johnson test to have mild disease. And that's exactly what happened. They're probably equally effective. Why do I say that? In the Johnson & Johnson test, a month after being vaccinated with that single dose of Johnson & Johnson, no one was hospitalized and no one died. That's great protection. You can't do better than that. You might already have heard that fetal tissue was used in the production of the Johnson & Johnson vaccine. No, no fetuses were used. What happened was in 1985, a few cells were taken from the retina of a fetus. It was from an abortion, and it was used like so many other lines of cells to develop lines of cells. They weren't continually getting fetuses, they were growing these cells. And so many of the life-saving medications you've already taken were developed using these lines of cells. The daughter cells of this original group of cells that was collected are used in the production of the Johnson & Johnson vaccine. So depending on your beliefs, you might think this vaccine is not for you. And so please tell us if you don't want the Johnson & Johnson vaccine, because we want to vaccinate you and we want to find a vaccine that you like. For so many of you, the single dose of this really robust vaccine will be the right thing to do. And we just want to vaccinate you. So a lot going on, so much more vaccine, more things we can do together in public, more people eligible. It is still an uphill fight. We still have a lot of people to vaccinate, but we can start to see a time in the future, if we don't have another surge, if you're safe and don't spread this disease around, very soon when we can start to feel safer. And I'm really looking forward to that. We'll be back with more vaccine news as soon as we have it. Thanks for tuning in. Talk to you soon. Bye.